Hi, my name is Dr. Kat Kesty, and this is Dr. Chelsea Kesty. And today we're going to be talking about GLP-1s, weight loss, and facial aging. So let's dive right in. Dr. Kesty, you, like me, have probably seen a lot of patients with facial changes due to GLP-1s. Tell me about your strategy for these patients.
Well, let's go over what happens and what they usually complain of. Even like young patients who are in their 20s, 30s, and 40s, who usually have much more preserved collagen, are actually losing a lot of the collagen and the fat pads that provide support, especially in the cheek and the jaw area. And so we're noticing a lot more nasolabial fold and jowl much earlier than we used to, just because of the kind of accelerated, gaunt or aging look that people are kind of coming in with.
And so when someone comes in and they're on GLP-1s or a similar weight loss medication, are you going ahead and treating those changes when you see them? Or are you discussing, waiting until they're at their goal weight? What's your strategy?
Early intervention is my strategy because you want to hold on to as much collagen that you have, or at least stimulate some of the regrowth early on. So usually my strategy includes lasers to help with overall rejuvenation, but also preservation of what people have going on right now. And so it's almost like hair loss, where a lot of the accelerated aging that's happening in the hair follicle is also happening in the collagen. So as much as we can hold on to hair, it's the same thing. I approach it the same way. As much as we can hold on to those fat pads or those collagen little cells that are so fragile to those GLP-1s, that's what I want to do.
So you're seeing hair loss and skin and facial changes in GLP-1 patients?
Yeah, just to clarify, we are seeing a lot of some hair loss, hair thinning, accelerated, any types of kind of aging. We're definitely seeing that because it's those like micronutrients and micro support that a lot of the GLP-1s are kind of going after. And that's not their intention, but it does happen subsequently or as a side effect.
Yeah, I think, some people may forget that when you're on a GLP-1, it's basically forcing you into a starvation mode, right? You're taking in way less calories than you either were taking in before or that your body needs to function. And our hair follicles and our skin are sometimes the first thing when the body needs to divert resources to like the brain and the heart, and the kidney, liver, all these really, really important organs. We are losing our hair and we're losing the collagen in our face because your body's trying to preserve itself, right? Like it's trying to live, and in a starvation mode, it has to divert or change the energy, move it to where it really needs it, like the brain.
For sure. I mean, things that are essential is where all the calories that you are intaking, including like protein and things like that, they're going to go to the essential things, where more cosmetic things, which is obviously the world that we work in, is going to be hair, skin, and nails. So you're going to see nail fragility, you're going to see skin laxity, a lot of loss of collagen, and then hair loss. Those are things that we are seeing in patients for sure.
Yeah, definitely. So let's start with skin. So you said you like lasers for your patients. Tell me about that.
I mean, definitely just doing a series of lasers to help at least try and treat the underlying collagen, do some, damage, and then remodel from there. That's helpful. But as part of the remodel process, I tell my patients they should definitely seek nutrition help, or at least find protein and adequate calories to kind of keep up with the recovery process as well. Electrolytes, hydration, protein, all the things that we need to build that collagen back up, then those patients definitely need to intake those as well.
Yeah, I'm doing a lot more lasers for skin laxity in my younger patients with GLP-1s that, we used to do on patients that were 50, 60, 70, and now we're doing on patients 20, 30, 40. So it's good that we have the experience with, really how much can you tighten this area with lasers? And the answer is with the right lasers, you can tighten that a lot. You can make a significant difference. Now we're doing it on younger and younger patients because there's so much skin laxity. I mean, I'd say that's a massive problem with GLP-1s. It's just the amount of skin laxity that patients have either due to loss of actual fat in the face, so that skin doesn't have anything to sit on, or, like you were saying, the skin quality just tanking because of the body just trying to survive and not producing as much collagen, elastin, not bouncing back, not looking as healthy. So it's great that we have all these lasers, all these options for patients to treat the skin laxity. just in a younger population now because of the GLP-1s for sure.
So what are your favorite devices for skin laxity that you're using in patients?
I would say I have two kind of general categories of skin laxity for the lower face. I would say my tried and true, my favorite is going to be the ablative lasers. So, I love doing a fully ablative erbium, a fully ablative CO2 on the lower face for patients. I think you can get so much tightening even in one session, with 7 days downtime. You can make such a massive difference in that lower face, and you can do that in pretty much any age. If they don't have that downtime, then you can do a series of some skin tight with some radiofrequency on top of it. I like that too for my patients that have no downtime. So two kind of different categories that I like for that lower face. So we've talked about skin laxity. Let's talk about revolumization because I think that's something that patients are asking about as well. Once you have that skin quality up, we need to build back some of that subcutaneous volume that we've lost with the body fat percentage going down. So you're the Sculptra queen.
Well, I think the background is that Sculptra, we used to use it for HIV and AIDS patients when they lost a lot of weight in the face. And so that's kind of a tried and true thing. When you have massive shifts in the facial volume, that Sculptra will just naturally rebuild that. That's what its first FDA approval is for. So I think that, massive changes in the structure of the face is going to be combated a lot by Sculptra or other biostimulating fillers. But usually the approach is also different, right? So we're going to the bone and laying on top of the bone that product. So to fill that where the fat pad used to be is to fill that back up with collagen. So that's the whole point of that. And that's the technique as far as where I am putting Sculptra. So I'm not usually putting that in the subdermal or dermal plane. That's, a little bit too much, especially for the patients who are going to go get a facelift and things like that. Really combating that fat pad loss that lives on the bone or even bone loss that I am seeing in patients. That's going to be the most important to kind of keep the facial structure supported and keep your original facial structure, intact.
Yeah, because we want to keep patients looking like themselves. So kind of rebuild what was there, not necessarily add more volume than was there before they started GLP-1s or, 10, 15 years ago.
Yeah, and I think that's definitely a cautionary tale to using hyaluronic acid fillers that, especially even in the subdermal or sub-Q area, is going to be definitely more cautionary because of the fact that you can overfill somebody to look more fake than they actually would be, especially as people get thinner and thinner. The effect of, 1 cc or 2 cc's or 4 cc's, or some people are getting 9 cc's, that's a lot of filler and volume that is just not going to look natural. So that's why I usually choose either being cautious with hyaluronic acid fillers or using something like Sculptra that's just going to naturally kind of build over time. And we can be, conservative about that.
Yeah, I always tell patients the lower BMI you are, the more conservative with filler you should be, and especially with our patients on GLP-1s. I mean, I completely agree with you. What I would have done a year ago, once they lose, even 10, 20 pounds, for some people can make a massive difference. I'll do half of that. So let's talk about wrinkle relaxers and your GLP-1 patients. Are you finding that they need more Botox? Are metabolizing it quicker? What have you found?
I think they're definitely metabolizing it quicker just because of the whole starvation mode that most people are going to report. They're not intaking the calories, so your body's going to digest what it's got. And unfortunately, if you have filler or wrinkle relaxers in your skin, that's what it's going to digest because those are unnecessary and doesn't really discriminate against anything else. So I am seeing a higher turnover. Patients who were getting Botox every 3 to 4 months, it becomes 2.5, maybe 3 months if we're pushing it. But usually I combat that with a higher dose of Botox or changing brands. That's helpful as well. But also just the expectation that as long as you're on this medicine, you may just have a higher turnover.
Yeah, I completely agree with you. I'm seeing that as well in my patients. So higher turnover of both Botox and, sometimes you need more filler, sometimes you need less filler, and sometimes you need it more frequently on the GLP-1s as well.
All right. So what are you seeing with hair and hair loss in patients on GLP-1s?
I would say I'm seeing two major types of hair loss with GLP-1 patients. One is going to be that telogen effluvium, which is where the body undergoes some sort of stressor, weight loss, weight gain, pregnancy, change in hormone, surgery, major stressors, life events. And about 12 weeks or 3 months later, they're seeing a massive shedding event. The good thing about that telogen effluvium with the GLP-1s is that we know that with telogen effluvium, every hair that you've lost during that shedding event will regrow eventually. So it's not a permanent hair loss. The other type of hair loss that I'm seeing would be just an overall kind of malnutrition hair loss, which would be not enough protein. Are you getting vitamin D? Is your thyroid okay? Iron, all of those other things that, if someone isn't eating as well as they should be, they're missing a nutrient. Maybe they're getting, just frail hair because, again, like we were talking about earlier, the body wants you to be happy and healthy. If you're not getting enough calories, you're not getting enough protein, you're not getting enough nutrients, it will take what you do give it and put it towards more vital functions than, growing hair. So that's kind of what I'm seeing in my GLP-1 patients. They have similar strategies to treat. I like my topical minoxidil. I love PRP for GLP-1 patients. I think it fits into patients' lifestyle really well. We do one a month for 3 months and then every 6 to 12 months afterwards. I will check labs on patients that are experiencing hair loss just to make sure that they aren't low in D or iron, make sure that their thyroid's doing okay too. So those are the two types of hair loss that I'm seeing with my GLP-1 patients.
Yeah, I agree.
And I would say the nails kind of go along with that in terms of just overall nails not growing as fast. Maybe they're a little bit more brittle, more frail than they used to be. They break easier. Seen a lot of nail changes as well, which goes along that same pathway. Nails are not vital. So the body's very, very smart and it will take resources away from growing really, really healthy, strong nails and really healthy, strong hair if you're not giving it enough resources like food and energy to do that. So,
Yeah. I think in conclusion, we don't want to hate on GLP-1s. They serve a vital function for patients. They are very popular at the moment. We just want to emphasize that early intervention and keeping the collagen that you have and then stimulating regrowth is really important, especially as you go forward in your GLP-1 journey, your weight loss journey, or even if you're stable at the time. We just want to emphasize that these are the effects that we are seeing and how we have tried to improve the laxity and the collagen in our patients.
yeah. Thank you so much for watching. If you have any questions, please let us know.